Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another important topic, that is ethanol toxicity. Previous video we have discussed about ethanol toxicity with respect to frank toxic effect levels, fetal alcohol syndrome, okay, cardiac myopathy, those things. But today we'll try to cover wherever this ethanol has been mentioned in our Clayson textbook. There are different chapters. Since ethanol is ubiquitous, it is having various target organ toxicity. So we'll see there are close to around 8 to 10 chapters are there in which ethanol is having as a target organ of toxicity. So each chapter will specifically will go through what are the important points. So let's directly dive into the question. Topic. Ethanol is first mentioned in the Clayson textbook. I'm saying chapter number 3, that is mechanism of toxicity. So how the mechanism is given in table 3.1. In this you see if you look into this receptor, channel and pumper, this ethanol is targeting GABA A receptors, and the location is CNS neuron, that is in your brain. That's why it is causing neurotoxicity. Okay, so read table 3.1 with respect to ethanol toxicity with respect to mechanism of toxicity. Not only that, you pause here, try to read about other examples. Whenever I mention a table in a certain slide, I would request you to stop the video here and try to learn about, for example, mucimol is there, other examples are there, how they are affecting this particular GABA A receptor. That also you try to correlate and read. For example, here picarotoxin is there, cyclodine insecticide is there, linden is there, which is a pesticide. So like this, you try to read. Now we'll go to next. Ethanol is again in continuation chapter 3 mechanism of toxicity. Ethanol is also mentioned under table 3.2, where it is impairing mitochondrial ATP synthesis. Okay, so the type of is whenever ethanol is consumed in large quantities, that is chronic consumption over a long period of time. So what it is causing? It is causing depleter of TPP inhibit dependent PDH and alpha KGDH, this type of particular enzymes. Okay, so it is inhibiting hydrogen delivery to the electron transport chain, acting on so and so mechanisms are there. So pause here, try to read about other examples also, like valproic acid is there. Okay, here hydrogen peroxide is mentioned. So those examples also you read. Coming in this only under point E, chemical causing mitochondrial DNA damage and impaired transcription of key mitochondrial proteins. So ethanol is causing this type of impaired transcription in the mitochondrial proteins also. So read table 3.2 under mechanism of toxicity. Now we'll see uh, ethanol, which is mentioned under the chapter 6, that is biotransformation of toxicants, and the metabolism of ethanol. And we are discussing Clayson textbook only, short textbook. Basically, ethanol, the target organ toxicity, there is CNS is there. It is affecting cardiac toxicity. Uh, uh, Throughout the chapter, we will see. But this particular slide, major target organ toxicity for ethanol is liver, because a huge amount of methanol metabolism is taking place in case of liver. So, ethanol morbidity and mortality caused by toxic effects of ethanol on the liver. The targeted toxicity in the liver. Why liver is a target organ toxicity? Because 90% of the dose of ethanol, it is metabolized in your liver. That is the reason. So there are three different principal pathways are there through which ethanol is metabolized. It is I discussed in the previous video also. Again, we will discuss with respect to place, and this particular diagram will discuss, which is given in chapter 6. So first pathway, that is primary pathway, ethanol is bioactivated by enzyme alcohol dehydrogenase. So any alcohol is there, it will get metabolized first. It will get bioactivated by this aldehyde dehydrogenase, sorry, alcohol dehydrogenase. Here ethanol dehydrogenase. So then it will form acetaldehyde. Here you can look into the structure. Alcohol is there, no? By the action of alcohol dehydrogenase, NAD plus is converted into NADH and H plus, and here acetaldehyde is formed. And this entire thing is taking place in the cytosol. Okay, within the cytosol. Okay, then next time, which is subsequently detoxified. Again, this acetaldehyde is detoxified back to acetic acid. How this particular reaction is taking place in the mitochondria by the action of enzyme aldehyde dehydrogenase. So here you see, which is subsequently detoxified to acetate by aldehyde dehydrogenase. So two enzymes here there, alcohol dehydrogenase, second one is aldehyde dehydrogenase. Okay. If you look into this aldehyde dehydrogenase, it exists in polyisomorph forms. Okay, polymorphism, genetic polymorphism is there. That is the reason ethanol metabolism across ethnic race, whether Asians, Caucasians, blacks, the metabolism is different because of the enzyme, this isomeric polymorphism observed. What is this one? Both enzymes, they will exhibit genetic polymorphism. Both enzyme is alcohol dehydrogenase as well as aldehyde dehydrogenase that result in higher concentrations of acetaldehyde. So what is happening in your body? Acetaldehyde levels are increasing. A fast activating isozyme of alcohol dehydrogenase, that is ALD2, and a physiologically very slow mitochondrial enzyme, because this particular process is taking place in mitochondria. One is taking place in cytosol, this is taking place in mitochondria. Okay, and this is taking in peroxisomes, and this is taking place in endoplasmic reticulum. You go back in and check in the textbook, then physiologically very slow mitochondrial isozyme of aldehyde dehydrogenase, that is ADLH2. Okay, approximately 50% of Asian populations, okay, Asian population, but virtually no Caucasians have slow aldehyde dehydrogenase. So this particular second type of ALDH2, 50% of Asians it is not having, it is saying. Alcohol consumption by people with with slow polymorphism will lead to uncomfortable symptoms. What are those? Flushing, nausea due to high acetaldehyde levels in your body. Okay, so that was our primary pathway. Now we'll see what is a secondary pathway. Secondary pathway is involves alcohol-induced enzyme, that is CYP2E1. So there are CYP family will be there, CYP3A4, CYP450, like that will be, alcohol, it is metabolized by this particular enzyme CYP2E1, which oxidizes alcohol to acetaldehyde. Okay, the enzyme is located predominantly in the liver cells. Okay, of particularly if you look into the histopathology, triad system will be there, central lobular lesion will be there, in that area, and it will require oxygen and NADPH. So whenever this exchange of electrons is taking place, NADPH is converted into NADH, and proton will be released. So it will require oxygen as well as NADPH in order to carry out this particular catalyst mediated metabolism. I'm saying, sorry, CYP2E1 mediated mechanism. Due to the nature of this enzyme, what CYP2E1, this reaction is most relevant or high doses of ethanol for chronic alcoholism. So majority of the metabolism is taking place by primary pathway. Some part will take by secondary pathway, and third pathway is catalase pathway. The third path involves catalase, which is taking place in the peroxisome. This is the thing. So there are three different locations. One is taking place in cytosol, second one is taking place in mitochondria, the last pathway, third tertiary pathway, it is taking place in peroxisome. So how much? A very few percentage. In this reaction, ethanol functions as an electron donor. Okay, because why? What is the polarity of the alcohol OH, which is attached to this C2H5, no, CH3, CH2, OH? I will discuss about the polarity, why alcohol having polar solvent nature. There I will discuss, then you will understand what is this one, why it is acting as an electron donor. Okay, uh, because on the oxygen, electrons will be there, free electrons will be there. So ethanol functions as electron donor, and the reduction of this hydrogen peroxide to water. Here you can see H2O2 is converted into 2H2. But problem, what is happening in our body? H2O2 is not abundantly present. So thus the capacity of this pathway is limited due to the low level of hydrogen peroxide. Since if this type of pathway need to be there, excessive of hydrogen peroxide should be there in our body. But as such, H2O2 is also toxic, that you have to remember. It is estimated that less than 2% of ethanol dose is metabolized through this pathway. So there are three pathways you have to remember. Exam in point of view, this only question you will be getting. Okay, read that particular diagram which is given in the case of Clayson textbook. Uh, in addition to that, alcohol is mentioned under ADMB, that is chapter number 5, absorption, distribution, exchange. So this is again very important. Because of this polarity nature of this alcohol, whether it is hydrophilic or lipophilic, able to cross the placenta, able to cross the blood-brain barrier. So physicochemical properties of a certain solvent is very, very important. So that is the reason that type of transport, we have different types of transport. Will be passive, active, ATP mediated, what is it? Carrier mediated, like this will be there, no? So this alcohol, a small water soluble compound such as ethanol, is rapidly absorbed and distributed. This is the only point which is given in the ADME. You read that chapter 5 in more detail if they have given more information over there. Okay, CYP2E1 mechanism, table 6.2 also they have given you examples with different CYP enzymes. So ethanol comes under CYP2E1. Okay, this is given in the biotransformation of toxicant chapter number 6. Then this alcohol is also mentioned under chapter 8, that is chemical carcinogens. So alcohol is associated with causing different types of cancer, either lung cancer or liver cancer or gastric cancer or throat cancer. Like that cancer it is associated. So how alcohol, this metabolism, whenever acetaldehyde, everything is really taking place, no, oxidative stress will takes place, free radical oxygen ROS will be generated, because of which it will lead to cancer. So this you read table 8.4, in that they are given the mechanism, mode of action. So alcohol is causing oxidative stress, thereby it is causing different types of cancers. Okay. Now we'll see alcohol under chapter number 10, that is developmental toxicology. How alcohol is going to affect the causing developmental toxicity. So they have given one table 10.1 they have given. In this 10.1 they have given different chemicals, drugs, examples, metals, okay, which are having which have a proven that these are all human developmental toxicants. So a pregnant woman, when she is exposed during different trimesters, different types of developmental toxic. Mostly it is during second trimester or early first trimester, late trimester, first trimester, like that. So ethanol is also listed in that one, which is causing, because of which ethanol is causing fetal alcohol syndrome. So if fetal FAS related thing we have discussed in the previous video, stop here. I have given this table in my earlier videos also. Try to remember the examples. If you remember this example, no, if there is a risk assessment toxicologist also, for them to identify the severity of the toxicities also, it will be very, very helpful, this table. So read this table, pause here. Then we'll see some equations in the class and textbook only. No, at the end of every chapter, they will give you some questions. So we'll discuss these two questions, which are given under developmental toxicology. Early prenatal exposure. During early exposure to which of the following teratogens? So all these are causing teratogenicity. Here the examples are there. It's most often characterized by craniofacial dimorphism. So there will be changes in this face, no, dimorphism, craniofacial head, microcephaly, small head will be there, no. Example, the answer is ethanol. But pause here, I to also read thalidomide. How thalidomide is related, at what pregnancy window period when it is exposed, how it is causing procomordia. Retinol, vitamin A toxicity, isotretinoin. These are the best examples which are causing developmental toxicity. Excessive vitamin A is good, but excessive amount of vitamin A will cause developmental toxicity. Okay, then because it is following hormesis type of a dose response curve. Then we have ethanol. This is our answer, because it is causing craniofacial dimorphism, fetal alcohol syndrome. Okay, then tobacco smoke. Previous video, last video, we have discussed about the nicotine in detail. This smoking during pregnancy period is also causing developmental toxicity. Brain will not be developed in the case of fetus, and abortion also takes place. And diethylstilbeston, which is associated with vaginal adenocarcinoma. Okay, parents are a pregnant woman is exposed, but the daughters which are born after 12 to 13, 15 years, at that time they were they are they found that from the from the studies, from the observations, that the cause was diethylstilbeston, which was causing adenocarcinoma, vaginal adenocarcinoma, in the case of females whose mothers, whose daughters, whose mothers were taking this diethylstilbeston. So read this in detail. Then we have next question. All of the following statements are true with respect to. So we need to identify which of the following statements are true, except the one statement. So this is the whatever the each statement is there. No, it is a wrong statement. In human, there is negative correlation between stress and low birth weight. No, this is absolutely wrong. So as the stress increases, there will be it is having direct relation. Increase in stress, there will be birth weight of that particular children will be decreased. Okay, um, this particular statement is not right. Pause here. Try to read about other options also. which are all true. Offsprings of white mothers have higher incidence of cleft lip or palate than do black mothers after adjusting for paternal race. This is a proven thing. You can go back and check in detail. White mothers, they have less incidence of cleft palate is there. What is the reason? You go back and check. Next, that probably it is because of the metabolism only. Cytomegalovirus is common viral cause of birth defects. So when I was reading about developmental toxicology, I had a wrong assumption that I was thinking thalidomide was the first incident which was associated with developmental or reproductive teratogenicity, but actually it is the first proven or first reported thing were with respect to CMV, that is cytomegalovirus. This is the one. So those pregnant women who got infected with CMV, no, they showed first birth defects. Okay, so before thalidomide also CMV was the one which the next one is folate supplementation during pregnancy decreases the risk of neural tube defects. This is also right statement. So how the folate is having a positive effect? You stop video here and read. Then cigarette smokes and ethanol are both toxic to placenta. Correct, because of the physicochemical nature of this one, they can cross the placental barrier and have adverse effects on the embryo as well as fetus. So this is also right. Okay, nicotine related whatever the thing we have discussed, tobacco and nicotine related last video we have discussed. Okay, so we'll go to next chapter. So we'll see how the ethanol is having adverse effects on the blood. That is hematopoiesis, poiesis or erythropoiesis, RBC. We'll see. So two questions which are given in chapter 11 in the Clayson textbook only we'll be discussing here. So we have which of which of the following types of anemia is properly paired with its cause. So one question with respect to know anemias, you will be getting different types of anemias, will be pernicious anemia, thalassemia, or because of the deficiency of certain vitamins, some anemias will be there, no? So that is always very confusing. So I would request if I get some time, I will only make the table. If it is possible with you people, write down which type of deficiency, which type of anemia it will cause. So we'll stick to the only options here first today. Iron deficiency anemia will lead to blood losses. So whenever there is a blood loss, it will lead to iron deficiency anemia because in the formation of hemoglobin, light chain, heavy chain structure will be there. No, iron is important. The next sideroblastic anemia, which is caused by vitamin B12. That is wrong. Instead of vitamin B12, it is vitamin B6. And megaloblastic anemia is caused due to vitamin B12 as well as folic acid. And aplastic anemia, ethanol is not related. Benzene is related. Radiation therapy or chemotherapy is related. The option would be right. And lead is not affecting any this thing. Again, megaloblastic anemia is same whatever we have seen, vitamin B12 as well as folic acid. These are the things. So read about anemias. Next, all of the following statements are true except. So we need to identify. So this is the green statement. It is wrong. Agranulocytosis is predictable and can be caused by exposure of number of environmental toxicants. This is more of generalized vague statement. We don't know how many environmental toxins which are related to agranulocytes. That's why this particular statement is wrong. Rest of the statements are right. What are those you see? Xenobiotics can greatly slow down the proliferation of neutrophils, monocytes, increase the risk of infection. That is immune system को down करने के लिए xenobiotics is there. Xenobiotic itself is the definition of xenobiotic is that only. Ethanol and cortisol decreases phagocytosis and microbe injection by the immune system. Heroin and methadone abusers, recreational drugs these are. Reduced ability to kill. That's why immune system in the case of this drug abusers, heroin and methadone users, it will be less. They're more prone to get infection. Toxic neutropenia may be mediated by immune system. All the statements are true except this particular green statement. So as I told, read about different types of anemia. One question you might get in your exam. Then we will see how the adverse effects of ethanol on the liver under chapter 13. So in the chapter 13, they have given table 13 too. They have given types of hepatobiliary injury. If you look at a typical liver structure, no, you have histopathology when you do know of the liver, you have different zones will be there, zone 1, zone 2. Okay, that is another slide I will tell you. But this type is the fatty liver injury, hepatocyte death, different types are there. So ethanol is causing fatty liver, ethanol is causing hepatocyte death, cell death because because of oxidative stress, lack of oxygen to these hepatocytic cells will take place. Then ethanol is causing immune mediated response. Ethanol is causing fibrosis and cirrhosis. So here you can see different pathway. In the last video we have discussed how it is affecting kapha cells, how superoxide radicals are released, how it is causing lipid peroxidation. So how it is causing hepatocyte death. All these things we have discussed. Okay. So remember different regions. Now, as I told you, different regions in that when you do histopathology of the liver, there are different regions will be there. Zone 1, zone 2. Okay, triad system will be there. So ethanol is affecting particularly zone 3 hepatocytes. Okay, that is more hypoxic and greater imbalance in bioactification and detoxification reactions. And ethanol is also affecting stellate cells. Okay, activation and transformation to collagen synthesizing cells. So pause here, read. If possible, try to read about other examples also, which type of liver part they are affecting that you read. So in continuation with adverse effects of ethanol on the liver, we have two questions which are given in the lesson chapter only, and they have discussed about alcohol abuse also. So alcohol abuse, which is related to, we have seen the mitochondrial pathway. No, it is affecting NAD. Okay, how the reactive oxygen species are released. So you read here in the mitochondria. We have discussed about we have discussed three different regions, three different enzymes, how they are affecting. So we'll directly see only the questions here. The inheritance of slow aldehyde dehydrogenase enzyme would result in which of the following after ingestion of alcohol? It will lead to nausea. Other types, high ethanol tolerance, little response, or low dose, because we have discussed here we have discussed about ALD and fast ALDH. We have isosomes polymorphism we have discussed. No, so if you understand the concept here, you will be able to address this question. Ethanol is not known to cause which of the following types of hepatobiliary. In the table, if you remember the table, you will get the answer is canonical cholestasis, fatty liver, hepatocyte death, fibrosis, immune mediated response. The previous table, that if you remember, you can able to answer this particular question. Next, we'll see how the adverse effects of ethanol in the nervous system. In the nervous system, particularly if it is exposed during pregnancy, fetal alcohol syndrome, microcephaly. So the question given in chapter 16 is prenatal exposure to ethanol will cause mental retardation, hearing deficits in the case of newborn. Cellular basis of neurotoxicity is microcephaly, small head formation. Fetal alcohol syndrome का a characteristic feature it is. Okay, stop here. Read how it is affecting delayed myelination of white matter, how it is affecting neuronal migration. Okay, facial development, that is craniofacial dysmorphism. Okay, then we'll see how it is affecting, alcohol is having adverse effect on the heart. Previous video we have discussed about cardiomyopathy. So question only we'll see here. Following statements regarding cardiac manifestation of ethanol consumption is false. So alcohol will have various characteristic features whenever it is having adverse effects on the heart. So ethanol toxicity causes an increased threshold, and so it is ventricular fibrillation threshold. They are not associated with alcohol. Quinidine, antiarrhythmic drugs are they know they are causing ventricular fibrillation, not alcohol. So what are the rest of the statement which are correct, which are applicable to alcohol? We'll see. Alcohol toxicity causes decreased conductivity. So last video we seen because it is affecting calcium ATPase pump in the case of cardiac muscles, because of which it is decreasing conductivity. It is causing chronic alcohol consumption is associated with arrhythmia. So acute alcohol consumption is not associated, but chronic alcohol consumption is causing arrhythmia. Chronic alcohol toxicity can result in cardiomyopathy. One is a characteristic feature. Read directly given in Clayson chapter under solvents. Acetaldehyde is a mediator of cardiac toxicity. So whenever acetaldehyde levels in your body increases, the toxicity increases. Okay. So in the solvents only, whenever this alcohol, it is co-exposure with other type of solvents, no, increase in hepatotoxicity is increased. So it is a best example. So in the exam you might get a question like alcohol with CCl4, alcohol with certain solvent they will give. So you need to identify potentiation, synergistic additive, like that one question you will get. So pause here, read this particular example. Which of the following not an important enzyme in ethanol metabolism? You remember. If you remember that particular diagram I told you, you'll know alcohol dehydrogenase, CYP2E1 catalase, acetaldehyde, all these are involved. Formaldehyde dehydrogenase is not involved in alcohol metabolism. Direct question. Okay. Then we'll see what it is mentioned about alcohol in the case of forensic toxicology, analytical and forensic toxicology, chapter 32. So they have given a list of top 10 drugs they have given which are used for sexual assault. So although alcohol stands second, so whenever alcohol consumed victims are there, so they are more prone to sexual assault. How it is affecting performance monitoring? Okay, how it is affecting your what do you say, behavioral changes, psychomotor disbalance. So here you stop here once, which is mentioned in this chapter. No, you try to read this one. Okay. Then alcohol is also mentioned under analytical forensic toxicology. Which of the following is most commonly used as drugs of as a, if you remember the table, you will be able to give the answer. So what are the different ways to mitigate the alcohol toxicity? Fomepizole is used because fomepizole will act as an alcohol dehydrogenase inhibitor. Okay, so read this one also. Then we have under clinical toxicology, that is chapter 33. They have given table 33.3. Given they have given list of hospital setting on stat basis. So ethanol is listed as commonly measured. So whenever there is clinical toxic sampling is there, ethanol level they are checking in the your serum plasma. Okay, differential diagnosis elevated. Again ethanol we are checking. And differential diagnosis metabolic acidosis, this anion gap is there. No, there also alcohol, methanol, these are two alcohols, they are always trace in your sample collection. Okay, so that was about the alcohol toxicity. So we are discussing in detail about alcohol because you have to understand alcohol is a ubiquitous solvent. It is targeting various. It is affecting heart. It is affecting CNS. It is affecting developmental toxicity. It is affecting. There are different enzymes, ethnic variation, gender variation. Previous video also we have discussed about gender variations. It is listed in ISHQ3C. Okay, it is used as an industrial solvent. So co-exposure, not co-exposure, exposure of alcohol and its adverse risk will be more. So we need to read in detail. So one or two more videos I will be discussing in detail in some more points which are not been covered under these two videos. So thank you so much. Be curious for any questions. You can always write a mail to arya.priyanka18@gmail.com. All the best for your exam.